Every morning, millions of Americans reach for a small pill, Amlodipine, Losartan, or Lisinopril, and swallow it without a second thought. Most believe it's simply the blood pressure pill. Safe, routine, set, and forget. But emergency doctors keep seeing the same three preventable moments play out. A swelling that got ignored too long. A cough nobody connected to the medication. A pill that got stopped without telling anyone. None of these happen because the medication failed. They happen because a 12-minute appointment never had time to cover what actually matters. Quick question before we start. Which one are you on, Amlodipine, Losartan, or Lisinopril? Drop it in the comments, because the answer changes exactly what you need to watch for. Stick around, because we're covering all three, and the biggest mistake, the one responsible for more ER visits than any side effect, is still ahead. Now consider this. This quiet little pill deserves more attention than it usually gets. High blood pressure doesn't hurt. No ache, no warning twinge. That's exactly why it's been called the silent killer for decades, and why the American Heart Association points to it as one of the biggest drivers of heart attack, stroke, and kidney disease in this country. If you're over 60, here's what that really means for your life. It's not just a number at the pharmacy. Years of unmanaged pressure is one of the things that can quietly take away your ability to drive to see your grandkids, or to live in your own home without help. That's the real stake in independence, not just a stat on a chart. What surprises most people the first time they hear it? Your blood vessels don't just carry blood, they're lined with a thin layer of tissue that reacts to pressure the same way a garden hose reacts to being left on full blast for years. Eventually, something gives. That's what these medications are quietly preventing every single day, whether you notice it or not. Your medication works against that every hour, whether you feel it or not. And that's exactly the problem. When you can't feel the disease, and you can't feel the treatment working either, it gets easy to get careless. Skip a dose. Wonder if you even need it anymore. That's precisely where things go wrong. Let me show you why. Picture a man in his late 60s. Call him Robert. An illustrative case. Not someone we're identifying. Robert took his blood pressure pill faithfully for 2 years. Readings looked great, every checkup. So when his refill ran out 1 month, he figured he was fixed. Nobody told him to stop. He just assumed. 3 weeks later, a headache that wouldn't quit sent him to urgent care. His blood pressure was dangerously high, higher in fact, than before he'd ever started treatment. Robert didn't do anything reckless. He did something completely human. He just didn't know the rule we're about to give you. And we'll come back to exactly why it matters near the end. Never stop or change your dose without talking to your doctor first. Now, here's something surprising. One of these 3 medications has a side effect so recognizable. Some doctors can guess what you're taking before you even say the name. Let's find out which one. Amlodipine belongs to a family called calcium channel blockers. It gently blocks the calcium that normally makes vessel walls squeeze tight, so they relax and widen. Less strain on your heart. It's one of cardiology's first-choice options for high blood pressure, taken by millions of Americans daily. The part almost nobody expects: swelling, almost always in the ankles and feet. It happens because amlodipine relaxes the small arteries more than the veins that drain fluid back out. So fluid quietly pools in your lower legs. That's often the tell doctor's spot on site. A patient walks in with puffy ankles, and before the chart is even open, the guess is already halfway there. Wait, is that dangerous? One detail changes everything here. Usually, no. It's uncomfortable. It's annoying when your shoes stop fitting by evening, but it's rarely a sign of heart or kidney trouble. Elevating your legs, compression socks, and staying active during the day genuinely help. Some people notice it's worse after a long flight or a day spent mostly sitting. Gravity has a lot to do with it. But there's another side to this. Swelling that shows up suddenly, hits only one leg, or comes with pain, redness, or shortness of breath is a different story entirely. That's a same-day call, not a mention it next time. The reason that distinction matters so much is that one-sided sudden swelling can point to something else entirely, like a blood clot, which needs a completely different kind of urgency. A few other things people notice: flushing, an early headache in week 1 or 2, occasional dizziness, standing up fast. Most fades as your body adjusts. And a quick myth to clear up, because it comes up constantly: not every blood pressure pill reacts badly with grapefruit. That's a bigger concern for other calcium channel blockers, not typically this one. Ask your pharmacist about your specific prescription rather than guessing. That's medication 1. But let's pause for a second, because the next one comes with a warning that deserves your full attention right now, not next week. Losartan belongs to a different family. Angiotensin receptor blockers, or ARBs. Your body makes a hormone that tightens blood vessels shut. Losartan blocks the receptor that hormone would normally lock onto. No lock, no tightening, pressure comes down. Doctors prescribe it not just for blood pressure research in journals like Circulation shows ARBs can also help protect the kidneys, especially for people managing diabetes. Picture a woman at dinner with her family. Nothing dramatic, just a normal Tuesday. But her heart does something strange, a flutter, a skip. She blames stress or too much coffee and doesn't think more of it. The part almost nobody connects. That feeling can, in some cases, be tied to a mineral. Nobody thinks about potassium. Losartan can raise potassium levels, and too much can affect your heart's rhythm. That's not a reason to panic every time your heart flutters. Stress and caffeine cause that far more often. But it's exactly why your doctor orders blood tests periodically on this medication, not bureaucracy protection. It's also why your doctor checks in before you start potassium supplements or salt substitutes made with potassium chloride. A normal banana isn't the issue. Stacking several potassium sources on top of the medication is. Milder effects, dizziness with the first dose, or a dose increase. Occasional fatigue. Now, the one demanding your full attention, the same as we'll flag for the next medication. Any swelling of the face, lips, tongue, or throat, or sudden trouble breathing is a 911 emergency. But rare doesn't mean safe to not know about. What surprises a lot of people, Losartan is often what doctors switch patients to, specifically because of a side effect in a related drug that Losartan usually doesn't cause, which brings us to medication 3, and the symptom that sends more people back to their doctor confused than almost anything else on this list. Lisinopril is an ACE inhibitor. Instead of blocking the receptor like Losartan, it blocks the enzyme that creates that tightening hormone in the first place. Different mechanism, same goal. It's recommended by major cardiology guidelines as frontline treatment, with strong evidence for protecting the heart after a heart attack and slowing kidney damage in diabetes. Now consider this scene, one that plays out in pharmacies constantly. A retired school teacher, call her Margaret, starts noticing a dry, tickly cough about 6 weeks after starting a new prescription. No fever, no cold. Cough drops do nothing. She blames allergies or dry winter air and mentions it to no one for 2 months, never once connecting it to the small pill she takes every morning. She even switches laundry detergent at one point, wondering if that's the culprit. The twist is this: that cough is one of the most well-known ACE inhibitor side effects. The same enzyme Lisinopril blocks also breaks down a substance in your lungs that, when it builds up, can irritate the airway. Not dangerous, but exactly the kind of symptom that shows up weeks later, which is why people like Margaret never connect the dots. If that's you right now, realizing you've had allergies for 2 months, don't just push through it, and don't stop the medication on your own either. Tell your doctor. Or, there's a common fix, and you already met it. Losartan is one of the medications doctors switch patients to specifically because it usually doesn't cause this cough. Now, the warning demanding the same full attention as Losartan's. Angioedema, sudden swelling of the lips, tongue, face, or throat. Rare, but ACE inhibitors carry a slightly higher risk of it than ARBs. If it happens, that's not call in the morning. Call 911 every time. Also worth knowing, dizziness when dehydrated, and like Losartan, elevated potassium, which is why routine blood tests matter here too. So now you've met all 3, and if you're being honest, you've probably realized they're more different from each other than you assumed going in. Before we get to what happens when people take more than one together, let's make sure your next appointment actually counts. Before we continue, if you've learned even one thing here you never heard from your own doctor, let us know in the comments. It helps more people find this. Quick question: do you take more than one blood pressure pill, or one of these with a water pill? If so, this next part is for you specifically. Combination therapy is common, and often more effective than pushing a single medication to a higher dose. But it means a few extra things deserve attention. Dehydration matters more. Vomiting, diarrhea, or a stomach bug can drop your blood pressure suddenly when you're on multiple medications, sometimes causing dizziness or fainting. If you can't keep fluids down for more than a day, call your doctor. Sometimes these medications need a temporary pause during serious illness, but that decision belongs with a healthcare provider, never made alone. Over-the-counter pain relievers matter more than people realize, too. Regular ibuprofen or naproxen can reduce how well these medications work and, in some cases, stress the kidneys, especially combined with Lisinopril or Losartan. Acetaminophen is generally the safer occasional choice, but ask your pharmacist about your specific combination. And one detail that catches people off guard: alcohol can amplify the blood pressure lowering effect of all three, raising the risk of dizziness or fainting, particularly standing up quickly. One more worth knowing before your next hot afternoon outside: heat and sweating can lower blood pressure too, on top of what your medication is already doing. Combine a hot day, a long walk, and a missed glass of water, and that's a common recipe for the lightheadedness that sends people to urgent care in summer months. Staying hydrated isn't just a general wellness tip here with these medications, it's doing real work. There's one more thing that rarely comes up in a rushed appointment, and it's connected to what seniors worry about more than almost anything: staying independent. Blood pressure medications are one of several factors linked to increased fall risk in older adults, according to research reviewed by the National Institute on Aging. Not because the medications are dangerous, because they're doing their job. Lower pressure sometimes means a brief dip in circulation the moment you stand up too fast. That second or two of lightheadedness is exactly when falls happen. And a fall at this stage of life is one of the more common reasons an independent life at home turns into a hospital stay. The fix is almost embarrassingly simple, and it works. Next time you stand up from bed, pause. Sit at the edge for a few seconds first. Stand up slowly. Let your body catch up before you walk. The same goes for standing up from the couch after a long TV show, or getting out of a hot bath, which can make that dip even more noticeable. One habit: it prevents more falls than people realize, and it costs you nothing but a few extra seconds. At your next appointment, here are questions worth writing down now, before you forget them in the parking lot. Is this medication still the best fit for me, or has anything changed that might affect that? Health shifts over the years: kidney function, other new prescriptions, even weight changes, and a medication that was perfect 5 years ago isn't automatically still the perfect choice today. Should I be getting regular blood tests for kidney function or potassium? For Losartan and Lisinopril especially, this isn't optional. It's part of the deal. What symptoms mean urgent care versus the emergency room versus just calling your office? Having that hierarchy clear in your head before you need it is exactly what separates a calm phone call from a panicked one. Are there over-the-counter medications or supplements I should avoid? And if I ever need to stop this medication, how should that be done safely? That last one matters most. Some blood pressure medications can cause a dangerous rebound if stopped abruptly. Even when that risk is lower, like it generally is with these three, the safest path is always a conversation with your doctor, never a personal decision made alone. Medication does the heavy lifting, but it works even better with support. The American Heart Association points to reducing sodium, staying active most days, managing stress, limiting alcohol, and sleeping enough as habits that meaningfully support blood pressure control alongside medication. None of that means giving up everything you enjoy. It means small trades. A short walk after dinner, reading the sodium content on a soup can, rinsed canned vegetables. Small habits stacked over months genuinely move the needle and may let your doctor keep your dose lower over time. Most people get this next part wrong. They assume blood pressure medication and lifestyle changes are an either-or choice. Pick one. That's not how it works. Think of the medication as the seatbelt and the lifestyle habits as careful driving. You genuinely want both, not one instead of the other. And if you're sitting there right now realizing your own allergy cough sounds a lot like Margaret's story, that's exactly the moment this video was made for. Here's one last thing worth remembering, maybe more than anything else we've covered. The biggest danger with these medications usually isn't taking them, it's misunderstanding them. Most emergency visits involving these three medicines don't happen because the drug turned dangerous. They happen because a patient never learned what normal looks like and what doesn't. Let's bring it together, because clarity here saves lives. Call 911 immediately for swelling of the face, lips, tongue, or throat, difficulty breathing, chest pain, or sudden confusion, slurred speech, or one-sided weakness. Those last three can signal a stroke, and every minute counts. Call your doctor the same day for sudden or one-sided leg swelling with pain, a persistent new cough on Lisinopril, frequent dizziness, or a blood pressure reading way outside your normal range. Mention at your next regular visit mild ankle swelling, occasional mild dizziness, or general questions about how things are going. 3 clear categories. Print them out. Stick them on the fridge. Whatever it takes to have them handy the moment you actually need them. Remember Robert from the beginning? He didn't lose anything permanent. A scary week, an adjusted routine, and he was fine. Not everyone's story ends that easily, which is exactly why we spent 10 minutes on this instead of 10 seconds. Tomorrow morning, when you reach for that pill again, it won't just be another tablet with your coffee. You'll know what it's actually doing inside your body. You'll know which symptoms are nothing to worry about, which deserve a phone call, and which mean drop everything and dial 911. And you'll know the rule that matters more than any of it. Never stop this medication on your own, no matter how good your numbers look. That's the kind of thing most patients never get told clearly. Today, you did. If this gave you even one thing you didn't know 10 minutes ago, write down the questions we covered and actually bring them to your next appointment. Have you dealt with ankle swelling, that persistent cough, or a dizzy spell standing up? Tell us in the comments, and if you know someone who takes one of these 3 pills every morning without really knowing why, send them this video. It might be the most useful 10 minutes they spend all month. Take care of that heart. It's been working for you since before you could walk. It's worth understanding what's protecting it. If this kind of clear, honest health breakdown is what you're looking for, this is exactly what we do here at Prime Health Insights every single week. Hit subscribe and turn on notifications so the next one doesn't slip past you. And while you're at it, tell us in the comments which medication or health topic you want us to break down next. We read everyone.